name is Dr. Tim McCreary. I'm a professor of psychiatry within the DMSC, or Doctor of Medical Science Psychiatry track of Rocky Mountain University of Health Professions. And I'm also a practicing clinician, a PA here in Utah. I've had a chance to work with some amazing patients on the Ute Reservation for the last 7 years, and many Native American groups within the Wasatch Front. I've been a PA for 15 years, and in that time I've also been blessed to go and do work in other countries as well, working with vulnerable populations. One of the things I discovered in my work with the vulnerable underserved populations of Utah is that there are a lot of mental health needs that continue to go unmet. And some of these unfortunately result in incarceration rates that are much higher than they should be, reincarceration rates, families that are broken up, substance abuse, and a lot of crime, which costs all of us. I am passionate about getting more mental health services to Utah's citizens so that we can create an even better, safer place for our families. I hope that you'll join with us in our legislative proposals for this year, and I look forward to sharing this message with you. Thank you.
Hi, my name is Ariana Golchin, and I am a psychiatric PA currently practicing at the University of Utah Neuropsychiatric Institute. I work on an acute stabilization unit and have been there for just over a year now. Advocating and educating others on the importance of mental illness and behavioral health as a whole is something that I am extremely passionate about. Before I began PA school, I worked at an adolescent day treatment center in addition to working on inpatient units with the pediatric and geriatric populations. I also was heavily involved in research as an undergraduate at the University of Utah, focusing my studies on suicidal adolescents and their biological family members. In my roles as a PA, I also love to precept students in addition to teaching lectures at various PA programs. Motivating, inspiring, and building competent and confident clinicians is very important to me. Mental illness is extremely prevalent in our communities, and we as psychiatric PAs play a very special and important role in increasing access to health care.
So this is what we propose. We'd like to include PAs that are qualified, psychiatric PAs, into the Utah Mental Health Practice Act. According to the Bureau of Labor and Statistics, there are about, on average, 311 mental health care providers per 100,000 people. In Utah, that number is about 30% less at 209 mental health care providers per 100,000 people. The mental health provider statistics in Utah are abysmal. There are a little over 5,000 providers to serve the entire population of the state. And Utah has more mental health needs than the average U.S. state, as indicated by our suicide rate. Utah is actually the 5th highest suicide rate in the country. The opioid crisis is also a big problem here in Utah. With over 47,000 opiate overdose deaths in 2017, that's more than automobile accidents or even firearm-related homicides. So what is the Utah Mental Health Practice Act? Well, this is the law that establishes what disciplines, what professionals can work within mental health care. Obviously, our physician psychiatrists from either osteopathic or medical doctorates are able to practice within mental health as their training permits. Advanced practice registered nurses working in psychiatry or mental health nursing. And of course, we have their interns, the psychologists and their interns, marriage and family therapists, licensed clinical social workers, and those who are training to be so, as well as the associate and full clinical mental health counselors. These individuals play a remarkable role in trying to meet the very understaffed needs of Utah's citizens. So among the professions, there are the licensed clinical social workers, marriage and family therapists, associate marriage and family therapists, and those who are clinical mental health counselors, and those who are training to be so. We believe that the closest profession to ours in transitioning to mental health are the advanced practice nurse practitioners. Like PAs, they receive a broad education in general medicine and then can choose to further specialize in mental health by pursuing a transition course, taking a separate mental health board exam, and proving 4,000 hours of contact within mental health.
What does the education look like for a PA? A PA's medical education and training is rigorous. PA programs are approximately 27 months, so roughly 3 academic years. The PA school curriculum is modeled on the medical school curriculum that involves both didactic and clinical education training. In the didactic phase, students take courses in basic medical sciences, behavioral sciences, and behavioral ethics. In the clinical phase, students will complete more than 2,000 hours of clinical rotations in medical and surgical disciplines, including family medicine, internal medicine, obstetrics and gynecology, pediatrics, general surgery, emergency medicine, and psychiatry. So how can an individual pursue becoming a PA? In summary, PAs are educated at the master's degree level. There are more than 238 PA programs in the nation, and due to the applicant number steadily rising, admission is highly competitive. UPAP, the University of Utah Physician Assistant Program, had over 1,800 applicants for just 68 seats in 2019. This profession requires a bachelor's degree and completion of prerequisites consisting of basic and behavioral science courses. Some programs require the GRE or other entrance examinations, in addition to job shadowing and volunteer hours. Programs require direct patient contact experience from diverse healthcare backgrounds. Typically, applicants average over 3,000 hours. So what exactly is a PA and what do our roles entail? So as one of the largest growing medical professions out there, PAs diagnose illness, develop and manage treatment plans, prescribe medications, and often serve as a patient's principal healthcare provider. With thousands of hours of medical training, PAs are versatile and collaborative. PAs practice in every state and in every medical setting and specialty, therefore improving quality and access to healthcare. PAs take medical histories, conduct physical exams, diagnose and treat illness, order and interpret tests, develop treatment plans, perform procedures, assist in surgery, make rounds in hospitals and nursing homes, and much more. There are currently 140,000 practicing PAs nationally and only 1.5% practicing in psychiatry.
Some of these PAs are also working in psychiatry. We were asked by other psychiatric professionals what would qualify a PA to work in psychiatry. And over the last couple of years, we've been working on establishing those qualifications. And this is what we came up with as we've met with our external stakeholders, other mental health professions like psychologists and licensed clinical social workers and psychiatric mental health nurse practitioners. We will also have PAs pursue 4,000 hours of clinical practice post-national certification of PAs. 1,000 of those hours will also include supervised therapy and 2,000 hours of clinical practice under a licensed mental health care provider. They'll also need to pursue a postgraduate academic certification in psychiatry. That may be a degree awarding or a certificate awarding program, and that will count towards 1,000 of those contact hours. They'll also need to pass the National Commission of Certification of Physician Assistant Psychiatry Board exam and obtain the certificate of added qualification in psychiatry, as well as maintaining their general practice boards, which require 100 CME every 2 years, and to retake the Physician Assistant National Recertification Examination every 10 years. So the scope of practice of these psychiatric physician assistants will be determined by their education, training, and experience, which will be verified by an approved credentialing and privileging process. These PAs would be legally responsible for the care that they provide in their mental health scope of practice, and they'll be able to offer both therapy as they are trained and provide medication management with psychotropics. They will be able to bill and collect for their services and reassign those collections to other entities, such as contract entities and their employers. They certainly will continue to perform comprehensive physical and psychiatric examinations. They'll initiate, modify, and maintain treatment plans, and they will be able to qualify as a designated examiner according to Utah statute, once they've completed the requirements as specified as a designated examiner. And they'll be able to, under that training, certify applications for emergency and voluntary commitments as needed. Okay, and they'll be able to independently authorize to procure any diagnostic and or therapeutic procedures or devices or pharmacological products. And for those PAs that are coming from other states or who have been working already in the specialty for a great deal of time, they will be able to work right into this act if they maintain their PA license, their NCC PA certification, and have obtained the CAQ, or Certification of Added Qualification in Psychiatry, and have had 5 years or 10,000 hours working within the specialty with a qualifying degree.
Thank you so much for supporting us in our commitment to increasing access to mental health care services.
Thank you for letting us share what we're passionate about. We hope that our message in this legislation will be a part of achieving greater healthcare access here in Utah.